My dear brothers and sisters, welcome to this brief presentation about the COVID-19. What is the role of yoga in this rapid spread of the COVID, which is spreading all over the globe with such devastating effects of deaths and economic downfall? We have been able to do a lot of research in the field of yoga by using the integrated approach of yoga therapy to deal with non-communicable diseases. Our first paper in British Medical Journal in 1986 showed how yoga can be extremely useful in dealing with bronchial asthma. Yoga for bronchial asthma, a controlled study. And that made us go global and continued the work of helping large number of asthmatics. So far, we have dealt with nearly 250,000 asthmatics throughout the globe, and most of them have been able to get relieved of their symptoms and almost come to the stage of total cure, stopping all medicines, taking no medicines at all, but still maintaining their good health and normalization. Then with that big boost that we got because of the global response, we started our research on various other fronts, started working on cancer, working on diabetes, and many other non-communicable diseases, hypertension, heart problem, epilepsy, migraine, irritable bowel syndrome, cancer, and whatnot. And we have so far published nearly 700 research papers in various journals. And to scale it up, most of you know that we took up the Niyantrita Madhumeha Bharat NMB project in 60 districts of our country, in which we scanned 2.5 lakh people and found out the prevalence, and then we gave them the yoga practice for nearly 3 months and got wonderful results. And the American Diabetic Association has made this as the best research for the last year, and our medical director, Dr. Nagendra, was able to present this, and we got a good presentation. And we have written nearly 40 research papers based on the extensive and in-depth data that we have been able to take. And using this data, we have been able to bring about many things, and nearly 13 research papers have been accepted for publications and published in some good journals of high impact factors. With this success, we are continuing to do our work in the field of yoga for non-communicable diseases. But now we have the bigger challenge of communicable diseases through the corona. And we had worked in the field of communicable diseases, mainly the tuberculosis and also HIV. And our good research papers that have been published in TB, in respirology, and other good journals have shown that yoga could be extremely useful to improve the health status of the TB and bring back to the normalcy using the yoga programs. Similarly, we have been able to show that the CD4 counts improve wonderfully well in the HIV patients in a randomized controlled trial that we had. The papers have been published in good journals. So with this, now we are ahead to deal with this pandemics of the COVID-19. What is the principle on which we work? As most of you know, the most important dimension that is needed for prevention is to strengthen our immune system. And if our immune system is good, is strong, it can combat and throw away the external infectious bacteria or the viruses. If our immune system is poor, we started getting haywire, then we have all the possibility to succumb to these viruses or bacteria from outside. So the question is, why do we get into this sort of distortions in the immune behavior? As most of you know, immune system has a very subtle capacity to sense who is a friend, who is an enemy. And once enemies come, then it's able to smash them out. While if these are the good friends, then it will support and see that they are helped. This is what is needed in any army, and this is what our immune system does, whether it's through the NK cells or the WBC or several other huge army that it's been able to create. And the weakening takes place and the distortion takes place because of our wrong approaches. And this in yoga is called the avidya. At the highest level of the intellectual knowledge base, there is going to be a distorted perspective of the world around us. In our mind, we have got the dimensions of pramana, viparya, vikalpa, nidra, smrutaya, the manifest form of the mind and the unmanifest form of the mind. Manifest form happens in our wakeful period and also in the dream state, swapna and jagrat. Here there is duality, there is consciousness, there is the dimension of thinking. But in the nidra and the smriti, we have the unmanifest form, in which the mind is in the seed form and it is not come to the wakeful consciousness or dream consciousness. And you can say it's something like a frozen form. It is something like the seed. And in the wakeful state, the thoughts that we get could be based on the right knowledge called the pramana. Pramana is the right knowledge. Or it could be the wrong knowledge. Viparya. Viparya is the mithya gnana. Mithya gnanam atadruva pradishtam, as Patanjali says. That means that a person gets jaundice, he thinks that the whole world has become yellow. Seeing a ghost in a post, seeing a serpent in a rope are all examples of viparya. So when this happens at the highest level of our mind, at the intellectual level, with the wrong knowledge, that gradually percolates down and comes and causing the imbalances in our pranamaya kosha, comes down to the physical body and starts the working at the brain level. And there could be distortions in our perception. And kiss is one example. And when it comes down to the physical frame, then it can hit different parts of the body. The most important aspect is our immune system. The immune system goes haywire and gets into distorted perspective, considering friends as enemies and enemies as friends. And as a result of that, it doesn't kill the outside germs, viruses, or the bacteria. Or it may not help in promoting the good things like insulin and others. So this is the one that creates the haywire behavior of the immune system. The second dimension is the weakening. We all know that the fear, anxiety, nervousness, and the stress has an immunosuppressant factor. The immune system gets weakened, it gets suppressed, and as a result, its strength reduces. So we succumb to various ailments again and again, again and again. That is a common flu or common fever or malaria or TB, many other things happen when our immune system is very, very slow, very, very weak. So these are the two dimensions of immune system. And if our immune system doesn't get into these two dimensions of haywire reactions and the weakening, then you have a solution to the infectious diseases or the infections coming from outside. And this is the approach that we have taken up in dealing with the tuberculosis or the HIV and other dimensions. And what did we do? So we use the integrated module of yoga, working at all the different levels, at the body level, at the prana level, at the mind level, the emotional level, intellectual level, and in the bliss level. This we call it the integrated approach of yoga therapy. And at the body level, how does the weakening take place? How does the stress manifest? We are all familiar that stress reaction gets started off in the higher centers of the brain, and it triggers the hypothalamus, which in turn creates two sets of imbalances, one at the endocrine front, another on the autonomic front. Sympathetic stimulation takes place, and that percolates throughout the body, causing the stress reaction. Increased breathing rate, increased heart rate, increased stiffness of the body, and all these things happen. And this is a mandatory reflex that such a stress reaction is very necessary to meet the demanding situation that is needed. And this is augmented by the endocrine imbalances with increased stress hormones that are being secreted to a greater measure. And both these things work hand in hand. One is the electrical dimension, another is the chemical dimension. And it produces the needed stress reaction to meet the challenges. But as it is continued, then when the demanding situation is over, the whole system comes back to normalcy with the parasympathetic taking over, bringing the balance. And so also the excessive secretion of the stress hormones get reduced to normalcy. And this is what happens in all of us in a stress condition or a fear dimension or the anxiety and other things. And this is very necessary in the human system. It's a mandatory reflex. But when this continues for long, and then you have the problem. The increased blood pressure gets stabilized there. And the increased heartbeat and the breathing rate will all cause tremendous amount of imbalances throughout the body, which continues, and you end up with various different stress-related ailments. And particularly for the immune system, it starts getting highly suppressed, and its capacity and its strength and the power starts reducing. Whether it happens due to the reduced number of NK cells or the WBC cells, or because of the haywire reactions of the immune system, what happens is the immune system doesn't behave the way it has to behave with the power, with the proper knowledge and so on. So, what is the solution? Solution is to see that you reduce the stress reaction and bring it to balance as soon as the demanding situation is over. So this is done by the yogic practices, yogic asanas, the pranayama, the meditation, and all these things will help bringing this thing. And in particular, we have developed a special module that is called the cyclic meditation or avartan dhyan, based on the grand knowledge that has been given to us by Gaudapada, the teacher of Shankaracharya, in the Gaudapada Karika of the Mandukya Upanishad. And using this approach of stimulation, relaxation, we'll be able to give very deep rest to the whole body-mind complex. And how much of it we measured. And if a person has 6 hours of good sleep, the amount of rest that he gets is about 9%. 9% reduction in the metabolic rate, in the oxygen consumption. But if he practices this by 35 minutes, the Avartan Dhyan practice, then the metabolic rate can come down by 32%. And when such deep relaxation takes place, the immune system blossoms with higher strength, power, and this is what has been used to give very deep rest to the system to meet the challenge of stress and the stress results. This is one dimension that we do. So when we started applying these things, the relaxation component of the asanas, the slowing breath, and the corresponding reduction in metabolic rate of the pranayama, and calming down effect of the meditation, then we find that there has been wonderful research that came in the tuberculosis or HIV in the communicable disease as well. And this is what we want to bring it here to meet the challenge of the COVID. And we know that COVID virus is the biggest among the viruses. Normally all other viruses are very, very small and 0.005 to about 0.45 microns in size. But COVID goes up even to almost 1 micron, 0.125 microns and other things. And therefore it is one of the biggest virus. And it is very beautiful. It resembles the corona, the name deriving from the beauty of that. If you look at the coronavirus, it is so nicely designed, so beautiful. Whether that beauty attracts the immune system to take it as a friend and start succumbing to it is an interesting question one could ask. But the immune system should consider that as an enemy and see that it is almost removed from the system. So because of the wrong notion of the immune system getting attracted by the beauty of the corona, if it thinks that it is a friend, then you have the problem. This is what happens in diabetes or cancer. Somehow the immune system thinks that cancer cells are my good friends and allows the cancer cells to grow in the body. As all of us know, cancer cells are not viruses from outside, but they are inside us. And they all get born in our body as naughty children, not following the laws of apoptosis. So, if the immune system is normal, it can take care of such all distorted perspectives nicely. But once it has a wrong notion that it allows cancer cells to grow and becomes malignant. A similar thing can happen if the immune system gets attracted by the beauty of the coronavirus and doesn't allow the WBCs and the NK cells to do their activity to see that they smash them. But if it is normal, then it will be able to take care of that. Because our WBCs are much bigger in size and the number of WBCs in, for example, 1 cc of blood is about 3,000 to 7,000 such things are available. And if you take the whole body, you have millions and millions of such WBCs and large number of NK cells. And they can take care of it and see that the corona cannot enter and will be smashed. So what is the whole approach? At the body level, you give deep relaxation to the system so that the stress reaction, which is normally about to continue, is blocked and you have deep relaxation of the system. Therefore, the immune system is kept very nicely with its power, with its usual normal dimension. Similarly, at the Vijnanamaya Kosha, the knowledge base has to be brought forth again, and that's what we do through the Gnana Yoga. In the Gnana Yoga, we try to understand what is the real process of right knowledge. Thinking that we are only this physical body is a limited knowledge base. As the Upanishad tells us, we have got 4 more bodies or 4 more layers. Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, Anandamaya Kosha, which most of you have been hearing from me again and again. Similarly, in the world at large, in the creation, we have the physical world featured by the electromagnetic field. Then we have the bioplasmic field or the pranic field. Then more pervasive is the astral field or the mind field. Then much bigger and more comprehensive and deeper is the information field or the knowledge field of the Vijnanamaya Kosha. Then we have the biggest at the bliss field or the wonderful Anandamaya Kosha. So all these 5 layers in creations are in continual interaction. A change in one brings changes in the other things also. Similarly, in our body, we have all these 5 layers, 5 bodies, if you want to call, and there is one change in one portion can bring about the changes everywhere. So, what changes occur at the Vijnanamaya Kosha can bring about the changes in the body also and cause the distortions in the different organs and systems in the body. And particularly, we are interested in the immune system, and the immune system should not go haywire because of this wrong notion. So, the important dimensions that we have to do is that the proper knowledge base has to be built, and the fear of death has to be removed, and the anxieties and other things which are often the root cause for these imbalances, and root cause of this is the avidya. As it is said by Patanjali, avidya, asmita, raga, dvesha, abhiniveshaha, kleshaha. The inflictions are starting from the dimensions of the knowledge, the avidya, wrong knowledge percolates down and comes through what you call as the I, which gets distorted. And from there comes the raga and dvesha, attractions and repulsions, and comes down into the physical body, entering into the entire thing, and the wrong knowledge percolates down into the system. So these are called the kleshas or the afflictions in yoga. So once we correct here, the vidya is gone, these things also will go away. And this is what we have been able to find and utilize these dimensions. So the knowledge is very important, and correspondingly the working at the body level for giving deep relaxation to the system will be extremely useful. Then the pranayama dimension is to slow down the breathing, and thereby the metabolic rate starts coming down. So slow down is the most important thing. And bringing balance between the left and the right nostril, Anulom Vilom or Nadi Shuddhi, it's often called, brings about the balance which is distorted in the Pranamaya Kosha due to the Adi or the imbalance at the higher level. And the next level is at the mind level. Mind has the 2 wings. One, a capacity to think faster and faster and faster, sharpened mind, quicker mind, brilliant mind, and dynamic mind, energetic mind is one side. And the other side is calming down the mind, silencing the mind, tranquilizing the mind. Manaprashamana upayaha. These are like 2 wings on which we fly. But unfortunately, the first portion only is developed and the second has been neglected. That calming of the mind, silencing of the mind is grossly neglected in our entire education system. As a result, our children are so brilliant, so fast, so good, so full of energy, vitality. But if you ask them to sit quiet and calm and silent for a few minutes, it was the biggest punishment for them. So, we have grown gigantic on one front and become pygmies on the other. And this big imbalance at the mind level will percolate down into all aspects of our system and causes big imbalances in the form of stress reaction and the haywire reactions of the immune system and so on. So we have to bring this dimension of calmness of the mind in the meditation. And the Avartan Dhyan does it abundantly using the aspects of asanas and the pranayama and the meditation dimension. So key essence of meditation is to calm down the mind, silence the mind, and see that from the multiple thoughts you come down to a single thought and stay in that single thought effortlessly. As Patanjali defined, Tatra Pratyaya Ekatanata Dhyanam. Dhyana is to come in a single thought and stay in that single thought effortlessly, and the whole breathing rate comes down. There's the slowness that occurs, reduction in the metabolic rate, and keeping the wakefulness and not sleeping off is important. And then you have feeling of elation, lightness of the body, And these things help to completely charge our immune system and thereby makes it very, very powerful. So meditation is one of the best in doing these things. So we have got the relaxation component of the asanas, the slowing breath aspect in the pranayama, and calming down of the mind at the meditation level, and to overcome the emotional resurges, emotional imbalances with the violent emotions taking over us, you know, like anger, greed, jealousy, hatred, infatuation, arrogance. They all are increasing and causes the stresses and big imbalance in the emotional dimension. So I have to bring in calmness of the mind and thereby gain control over the emotions. And bringing balance is yoga. Samatvam yoga vichyate. Shita Ushna Sukadukeshu Samaha Sangha Vivarjitaha, as it said. And using this technique of bringing balance at the emotional level, that is reducing the powerful Arishad Vargas, Kama, Krodha, Lobha, Moha, Mada, Matsarya one side, and developing the wonderful qualities of peace, harmony, serving others, helping others, and control over the senses, all these good emotions, you know, they are the ones that are brought to fore in our science of emotion control. And therefore, we work at several levels to see that we have a total personality dimension that is brought forth. And thereby, you'll be able to see that the immune system is charged again and again, and reduction of the stress, giving deep relaxation to the system, and with the proper knowledge, the distortion of the behavior of the immune system is reduced. With these components of the yoga, now in the current context, we develop three modules. Modules for the people 15 years and below, 16 years to 60 years, and above 60 years. Take into consideration the challenges that these people normally do that. So we have developed simple modules about 10 to 15 minutes each, and this is all available in our web and can be used by anybody. And we started using that in various places as a preventive. And the other module that we have developed is to use this in hospital setup. When the people are lying on the bed who can not even get up, can we do something for them? They have done that for cancer patients, people who are in the final and severe cases of cancer and other things. We have been able to use such techniques which can be done even while lying down on the bed. And these are the ones that we have developed as a module for the COVID, so that people lying down on the bed in the hospital scenario, they'll be able to use these things very effectively. And these are the four modules, integrated modules that we have developed and is available on the web and is open to everybody, whoever wants to use it. In Italy, we started using that because the corona has made devastating aspects there. And we had one of our very close friends who is a big cardiac surgeon of great fame. Unfortunately, he also got into this corona virus and he was admitted to the hospital and he went through very severe aspects of this thing. And people all were very worried and concerned that what happens to our great cardiac surgeon. And when he got to know about these techniques that we have developed in the Swami Vivekananda Yoga Sandhana Samsthan, which was sent by us to him, then he started using it. Very simple technique, slow deep breathing and lying down on the bed, thinking of the infinite and calming down of the mind, silencing of the bed, relaxing of the body, all these components he went on doing that, and the reduction of the anxieties and the nervousness and the fear associated with this thing, he started doing, and he started improving very fast. And we just got yesterday the news that he not only came out of the hospital, now two tests have shown the corona negative for him. And influenced by this wonderful self-experience, he has started sending this to hundreds and thousands of his people, clients who have gotten into these quarantines and also in the hospital things. And this is how in Italy it started spreading. And this is what we want to happen in all our quarantines and also in the hospitals. Simple techniques. Now We all are stuck to our houses, which is a very necessary step taken by our wonderful Prime Minister Narendra Modi ji to lock, and all of us staying home. We have plenty of time, and this is the great opportunity that God has given us, the nature has provided, to practice the yoga in our houses. In our rooms, we can do that. Such simple technique. So we want that everybody should practice these modules at least 4 times a day to prevent the onslaught of the corona spreading. You know, in the isolation, in our rooms, we can start doing that in the morning and before lunch, before evening dinner, before going to sleep. 4 times, 10 minutes, 15 minutes. Very easy to do that. And if you start doing that, then it will build up our immune system tremendously. And those people who are already in the hospital getting infected by the corona, we have the other module which they have to practice minimum of 4 times, if not more. Many of the nurses and other people can assist them to do these things very effectively. And this is the solution that yoga can provide, and we will be able to see that the immune system blossoms itself with power, energy, vitality, the right knowledge to see that the corona is thrown out of the system, and we prevent the diseases from that. Using the yoga technique, we will be able to see that the immune system gets alerted. This is what the vaccine does. When we take a vaccine, what happens if your immune system is alerted? Yes, such an onslaught is coming, and you have to be careful, and it prepares itself. Similar thing happens when we use yoga as a preventive, takes something role of a vaccine. And this is what we have started doing. And in the Indian Yoga Association, we have a large number of people who have been able to use that and see that they are getting the benefit. Then the other dimension that we have talked is to work at the global level. Many of you may be aware that the global consciousness field can be tracked to see the changes that are occurring at the global level by special instruments called random event generator. The Princeton University developed this as a peer project program almost 30, 40 years back. And Dr. Nelson, the leader of that group, was able to set up these 100 different instruments in all different parts of the world in different countries. And all these RECs continuously generate the data, and all these things are collated and analyzed as a central place, and Nelson has access to that, and he has been the leader in this field. And Roger Nelson has found that all these 100 units will show a big change in the consciousness field when events are global. The first thing that happens is the Diana's death, and the second is the millennium change, and many others. And we started working with him and started tracking what happens in the Kumbh Mela and etc. We have been able to show that there's a big change that occurs in the global consciousness field when such big gatherings come together and work for a particular mission. So we are so happy that when our Prime Minister gave us the mandate to have the clapping, showing our love and affection, our appreciation for all the people who are working in the country, on 22nd at 5 p.m., then it showed a big change in the consciousness field. And based on this thing, now we have developed a new program, and it is named by Roger Nelson and Srinivasan from Chennai as the Synchronized Global Prayers, SGP. And this SGP program has to be done by a large number of people and every day. And it hardly takes a few minutes. And we have developed a protocol for that. And it can be done 8 a.m. Indian Standard Time or 6 p.m. or both times. So we have the complete protocol given to you. And it starts off with the chanting of the Brahmari. The Brahmari, the humming sound, low frequency humming, will energize the whole system, and done 27 rounds, which will be about 6 minutes or so. And at the end of that, with our intention, with our resolve, that all of us working together will develop such a synergy to see that there is a big positive change in the global consciousness field which can throw away the influence of the COVID. Therefore, large number of people have started joining. Indian Yoga Association has brought out these dimensions with all the yoga masters and the huge network that the IYA has throughout the world. And therefore, we appeal to all of you to spare a few minutes of your valuable time for this change in the global consciousness, to develop a positive global consciousness field change. And that can happen when all of us put our mind and tune ourselves for the good of the entire world. And just like our Prime Minister made this whole country as one India, similarly, he has been approached to see that we build the whole world as one whole. And let us all work together toward this thing and see that we work as Vasudha Eva Kutumbakam, a big family. And this is a great opportunity that COVID has provided us. And we all have enough time staying in the house in the locked up condition, and we should all spend our times to prevent diseases, promote positive health, and pray for the well-being of the whole world. The famous Shanti mantra which says, Sarve bhavantu sukinaha, Sarve santo niramayaha, Sarve bhadrani pashyanto, ma kaschit dukkha bhag bhavet. That all people be happy and nobody suffer from different diseases. That everyone grow to greater and greater heights of happiness, health, and prosperity. And let there be peace in the world. Peace inside, peace in the immediate surrounding, peace throughout the globe. And I welcome all brothers and sisters of this community to join hands with us for this big movement that we have taken up in the Indian Yoga Association. Dhanyavad. Thank you.